Good evening again, Bahamas. I'm Altafiz Munnings. Thanks so much for tuning in. It's always great to see you on this Friday. We begin tonight with news on the COVID-19 pandemic as Ministry of Health officials are seeing a consistent trend of confirmed COVID-19 cases here in New Providence. Their statistics show that 1 in every 100 Nassau residents tests positive, and cases are continuing to grow. The Minister of Health cautions, though, that now is not the time to let down your guard. Jimonita Swain leads us off tonight.
Currently, there are 4,220 confirmed COVID-19 cases in the country, and health officials say 2,290 have recovered, while 1,803 remain active. 93 patients remain hospitalized, while the other cases remain in quarantine. Health Minister Ranwood Wells outlined a number of cases per island up to Thursday.
New Providence has recorded the majority of cases with a total of 3,099. This is followed by Grand Bahama with 635, Abaco with 145, Exuma 32, Inagua 19, Eleuthera 22, Long Island 12, Andros 8.
Minister Wells said 156 cases have locations pending. Social settings and workplace transmission accounts for what health officials are calling a consistent trend in increased cases.
We have a consistent trend of workplace exposures requiring a constant cycle of quarantining, deep cleaning, and sanitization. The workplace is now a hotspot. The message has not changed. We must take strong personal responsibility to protect ourselves and our families. We must avoid going out of our homes for non-essential reasons. Avoid social gatherings and practice preventative measures at home, church, work, and everywhere else we go.
And with international visitors set to return to the destination in a matter of days with the resumption of international travel, health officials were asked if they agreed with the removal of the 14-day quarantine.
Tourism and health continue to work together, and the COVID-19 task force will continue to make recommendations.
The task force makes its recommendation, and the government has to take all of the recommendations from the task force and filter it through the prism of the policy that the government seeks to move with in regards to how we look at opening our economy, how we address the concerns of our people, and we come up with one holistic policy.
Chief Medical Officer Dr. Pearl McMillan compared the reality of new cases in the capital versus those in the Family Island.
The stark reality is that 1 in every 100 Nassauvians have been infected with COVID-19. Bimini, Acklands, Berry Islands, and Cat Island have gone more than 28 days or 2 incubation periods with no reported COVID-19 cases. Cat Island leads with 50 days since the last confirmed case.
Officials also revealed that Super Club's Breezes is no longer being used as the COVID-19 National Response Facility. However, no additional information was provided on when that adjustment was made. Jimonita Swain, ZNS Network News.
Thanks, Jimonita. While COVID-19 positive cases in the country continue to escalate, particularly here in New Providence, as you've just heard, health officials are also concerned about the burnout experienced by healthcare workers fighting the COVID-19 pandemic. Chief Medical Officer Dr. Pearl McMillan says healthcare workers have been continuing to be infected with the deadly virus.
To date, 243 have tested positive for COVID-19. 226 have had high-risk exposures, with 35 in the Department of Public Health and 191 in the Public Hospitals Authority. 962 have had low-risk exposures and are being monitored. 415 have been cleared to return to work during the week of the 21st of September. That included 35 for the Department of Public Health and 380 within the Public Hospitals Authority.